My name is Jacob. This is my intramuscular video injection. So the first thing I'm going to do is I'm going to check my patient's chart, know that I have a medication that I need to administer. I'm going to check the original medication order, make sure it compares and everything is good. I'm also going to check my patient chart for any allergies that I need to know. The next thing I do is I'm going to take my MAR, I'm going to go over to the medication cart, perform hand hygiene, get that going. And then I'm going to do my 3 checks, my 5 rights with it. So I got my MAR, I got the name, and then I'm going to check on the first check, which is the medication. I'm going to unlock the cart, open it up, find my patient, and my first check, I'm going to get drug X. My first check is comparing it with the MAR. I'm also going to do the 5 rights. So I got the time, route, dose, medication. It all is compatible. The expiration of the medication is still valid. So then that's my first check. I'm going to bring my equipment over, making sure that the packaging is intact. There's nothing wrong with it. The expiration date is good. I just like a 3 milliliter syringe. Along for a intramuscular, I'm going to do a 23 gauge 1-inch needle for the deltoid. So then my expiration date is good. So then I'm going to take out my syringe and administer my needle.
You've been listening forever.
So it's also important to know the effects of the drug, the adverse effects of the drugs, any special nursing considerations of the drug, and the purpose of the drug. And make sure that goes along with the 3 checks, 5 rights. My second check is when I'm withdrawing the medication. I'm going to check it again, make sure it's the appropriate drug X. And I already done my conversions, so I know that I need a half a mil, 0.5. It's also important to know the appropriate drug range for the drug, so you're not giving a lethal dose or anything like that. So I did my calculations. This is my second check, my 5 rights. I got the right patient because I know he's in the room and it's appropriate time. So I have the time, route, dose, and the medication. This is my second check. And it all is compliable. So then I'm going to open this up. There you go. Sterilize the top. And then only touching the bottom part of the plunger, I'm going to withdraw the amount of air necessary for this injection. And then I'm going to puncture the vial and put the air inside. And then I'm going to withdraw the amount, only touching the bottom of the plunger. With a little extra, just in case there's room for any air bubbles. Okay. So I have that.
That's what I did.
I'm going to shake them out and make sure it is
That's what
the...
I did. We had dinner and then I gave him like 10 minutes and I said, go sit there and Claire, watch TV and don't talk. And
There you
he's
go.
like,
Now my
"No,
medication is
you're
complete.
gonna
Use the scoop
I'm
method.
just gonna listen to your stomach." I was there for like 10 minutes.
Scoop
and
it
I
up,
was like,
cap it.
well, I kind of hear one there.
No, medication is complete. I did my second check, making sure it was the right medication that I administered. The third check is me comparing the appropriate medication, along with 5 rights, the time, route, dose, medication, that it is correct. And then I'm going to put this away. So then I have retrieved the right medication. And this is the only medication administered at this time. And there's no allergies with this medication. So I'm going to lock up my cart. And now that I have the medication, I'm going to take some gauze and this, take all my equipment, take my MAR, and I'm going to go to my patient's room. So then I'm going to knock. Maybe I have a tray or something, but I'm going to knock. Once I get entry to the room, may I come in? Yes, okay. So I'm going to go to my patient. I'm not going to leave my medication out of sight. I'm going to introduce myself as a student nurse from Madison College, perform hand hygiene again. And now that I introduce myself, I need to identify my patient. I'm going to use 2 different markers, making sure it's compatible with my MAR. So, Jane Jones, can you state your full name and your date of birth? Okay. I checked your wristband. It's appropriate. Everything matches up. And I'm going to explain the reason for the medication, and that there's one for this time. So I'm explaining the medication to the patient and what the effects are and what it does. And if there's any special nursing considerations, then I would do them at this time. So everything matches. The patient is compliable with the medication. So then I'm going to go ahead and do the medication. So when doing that, it's always important to provide for privacy. So I close the curtain around the patient, so it's just us. And then patient's ready for the medication, I'm going to apply some gloves. And also before this, it's also important to double check the allergies of the patient. So then I did the allergies, and then I'm also once again going to do the final third check again, that I have the right time, route, dose, medication, and the right patient. All of these are connect, they're all good. So then it's time to administer the medication. So I'm going to do a Z tracking on the deltoid here. So I'm going to find the deltoid first. You find the chromium process, little part that sticks out. All right. And then I'm going to use 2 fingers, and I'm going to go right below that, right into the fatty part of the muscle. So once I found that right there, I would sterilize it with an alcohol swab and mark it for my Z tracking. Now, considering we can't do this on the mannequin, I'm going to show you. I'm going to do that right here on this wonderful pad. So, this is now my deltoid. I'm going to, from the center, work my way out in a circle. Okay, there we go. And then I have my medication ready. It hasn't left my site. I'm then going to displace the skin by 1 inch using a cross. And then I'm going to use a dart-like motion to stab it into the deltoid. Done. Stabilize it. I'm then going to inject the medication. I'm going to wait for 10 seconds so the medication is absorbed into the muscle tissue. And then after that 10 seconds, I'm going to release. And then this is going to go immediately in the sharps container. I'm not going to mess around with that, but for now I need to recap it safely for myself later. So then after I did that, I'm going to gently, with light pressure, apply that, make sure that all the medication went through, and it looks good. So then the medication has been administered. That's in the sharps container. I'm going to take off my gloves, put them in the trash, perform my hand hygiene, right? And then I need to document right away that I administered this to Jane Jones. So I would document the appropriate time and that it was administered. After that, I would make sure to provide any other necessary needs for the patient. I'm going to lower the bed, put it in the lowest possible position. The call light is within reach. There's nothing else that I need to do for this patient. This patient is comfortable. And then I would clean up all my supplies, take my MAR, and then I would finish documenting the effectiveness of this medication, and then come back within a allotted amount of time to make sure that the medication has its effectiveness of it. And then that completes my intramuscular injection.